Hi, this is Dr. Shim Ching, board certified plastic surgeon, Honolulu, Hawaii, and I'm going to talk to you about breast augmentation. Breast augmentation is one of the most commonly performed plastic surgery procedures in America, with about 300,000 cases per year, as measured by one of our societies, the American Society of Plastic Surgery. After 20 years of doing breast augmentation, I've seen some unique cases of breast augmentation, usually problems that I've seen from other surgeons because of the way the surgery was done. First thing that I see is scarring. Unusual scarring, visible scarring, and it's really unfortunate because any type of plastic surgery, the best type of plastic surgery that you can get is one where the result is undetectable. This can be in the form of a natural result. Everybody, I feel, benefits the most from a natural result, although some patients may want something that might be a little bit more than natural. But regardless, whatever is done, the surgery should be done with the most minimal scarring possible. Nobody wants to have a feature of their body that was intended to make them look better, but to have scarring that is unacceptable, very visible. And in the case of the breast, any scar on the breast that's obvious is a concern to a patient because every time they look in the mirror, they see a scar, or if they're with their loved one, that person will also see the scar on the breast, and it is somewhat unfortunate. And the kind of problem scarring that we see are hypertrophic or keloid scars, and those are scars where the scar is more visible. The scar is red, it's bumpy, it's swollen, it can feel very painful or itchy as well, and those kind of scars are not ideal. Usually, scars on the breast are either going to be underneath the breast or beside the areola, and both of these scars can heal so that they have problem scarring, are more visible, and are a concern to the patient. A lot of what happens with the scar after an incision is made on the body does depend on the surgeon and how they deal with that scar or that incision to close it up. Suturing is very important. Handling the skin in a very careful way is very important. How the surgery is done without too much damage to that incision when the surgery is being performed is also very important. So every little thing that a surgeon does during surgery can influence how that scar ends up looking. Now, if the surgeon has done a perfect job and the suturing is done right and everything has been done very carefully without too much trauma to that area, the rest of how the scar ends up depends on the patient. And that depends on the patient's body, the genetics, the environment to some degree, but a lot of it is patient factors after the incision has been sutured up or closed up properly. And that's something that, of course, the surgeon can't control, and the patient can't control that as well. So you have those two factors, and that's how we think about scarring in terms of how to get the best scar, which is predominantly the technique of the surgeon, and then afterwards it's up to the patient. But if the scar does end up more visible than we like, there are ways that we can minimize that scarring. We can do lasers, we can do injections of steroids or other compounds, or other medications to shrink that scar. Sometimes the scar is more visible. I will go back in and do surgery where we cut out the scar, resuture it, possibly a different way to get better scarring. My feeling is that a breast scar or any scar in the body should always be hidden in the best way possible. And that's how plastic surgeons minimize their scarring. They put the scar in an area of the body so that that scar is hidden, or it's camouflaged, or it's in a favorable area for scarring so that patients will have the best scarring possible. I don't feel that the scars on the breast are placed in an area that's hidden. Obviously, a scar on the breast is going to be hidden when a patient is wearing clothing or even a bikini. It is either underneath the breast or beside the areola in a fairly obvious place. So if there is problem scarring, it's going to be very visible for the patient and for others. An armpit incision is where I usually place the incision for breast augmentation. And I feel that not only is it a hidden area where people do not usually look because it's right at the top of the armpit, it's an area of skin where the skin is very thin, and we do know that thinner skin heals better without as much risk of problem scarring as other areas of the body where the skin is thicker, like the breast or the middle of the chest or the elbow or the shoulder. The other thing I like about placing a scar in the armpit is that the armpit generally has natural wrinkles or folds that almost look like a scar already. These exist in most patients. The wrinkle can be a little bit darker as well, so it already looks a little bit like a scar. When we place an incision in those natural wrinkles or folds that already exist in the body, we're already setting up the patient for a better scar. So that's why I really like armpit incisions when we do breast augmentation. I see a lot of patients, unfortunately, with breast scars. There's really not much I can do about it after the first surgery has been done. This can be very thick red scars underneath the breast or beside the areola, which are the two most common incisions that patients have when they go to another surgeon. Sometimes these scars can be indented, which also is very concerning to the patient. Some of these things can be fixed, but once a scar is somewhere and a problem scar, then it can be difficult to fix completely in some individuals, but though we usually can make them better. So that's why I feel to have the best scar in the first place is the best way to go. That's why I'm almost always using an armpit incision for my breast augmentations, and I do hundreds of them a year. And I feel after doing the surgery, all these different methods with breast scars and an armpit incision, I feel that the armpit incision heals the best and offers my patients the best scar possible. Second thing I see with breast augmentation is distortion of shape, and that can be from a variety of different factors. Of course, if an implant is not placed properly in the chest, if it's off to one location, either a bit too to the side, too much to the side, or a bit too much to the middle of the chest, or higher or lower than it should be, the breast will look off. The most common thing that I see is the implant is too low. We call that bottoming out. The implant is too low on the chest. It can be very asymmetrical with the other implant. It can cause the nipple and areola to look too high, and of course the breast is too low. So those are things that, as a surgeon, have to be very careful. There's always an ideal placement of the implant on the chest for every patient, and it's my job to put the implant exactly where it should be for that patient's chest. Any deviation from that is going to make the implant look off or unnatural or not the ideal shape. One of the more common revisions that I do for patients who have been treated elsewhere is to place that implant where it should be so that the breast looks the best for that patient. I have seen patients where both implants were just way too low. I'm not quite sure what happened in that kind of case, but the other surgeon placed the implants much too low. They've been told to wear a bra, to sit with their chest and back straighter, all these things, but the real reason why the patient was unhappy or the breast didn't look the way that the patient wanted was that the implants were not in the right place. Sometimes surgeons can tell patients certain things that may not be completely correct. It can be just a matter of opinion, but I have been able to help these patients by putting the implants back in the right spot, and the patients are much happier as a result. Patients can have implants that are way too high as well, and that will make a patient look unnatural. The implants just don't look right. They don't have a nice teardrop shape, and that's another reason why we may want to shift the position of the implants, because the implants weren't placed in the correct position. If you are considering breast augmentation, I hope you like this video. These are all important things that I've learned in my practice over the last 20 years that I should be considering and the patient should be considering before going into surgery. Please leave any comments that you have down below. Smash the like button, subscribe to this channel if you like this content, and we'll see you next time.